We're back. We're here in the Sam and Jennie Bennett Breast Care Center at Central Maine Medical Center. I'm joined by Dr. Schraft, who's a radiologist here. Can you talk a little bit about what you do in the diagnosis and treatment of cancer?
Certainly. I'm happy to be here, which is one of the places I work. I've been a diagnostic radiologist here at Central Maine Medical Center for the past almost 20 years. And one of my subspecialties is in breast radiology. That includes mammography, which is currently digital mammography, and we also do ultrasounds. We do biopsies, stereotactic biopsies, ultrasound biopsies, and we do MRIs of the breast.
Can you tell us what the scope of services are here in this center?
Well, that's pretty much it. The patient will come in basically for a screening mammogram.
Okay.
If everything's okay, patient will come back in a year. We recommend that patients start having their mammograms at the age of 40 and continue every year until they choose not to have them anymore. Some people will start having mammograms a little bit earlier. If, say, for example, your mother had breast cancer when she was 35, we would recommend that you start having mammograms at the age of 30. In any event, if, for example, a woman comes in for a screening mammogram and we find that there is a questionable abnormality, we will have them come back. And we'll do additional views with the mammogram. Sometimes we'll do a breast ultrasound. Sometimes we'll recommend that the patient have an MRI, which is something that we perform across the street at Central Maine Imaging Center. Most of those cases, we're going to tell the patient afterwards, everything is fine, come back in a year. But occasionally we will find something that we're not quite sure what it is. Typically, this is going to be an area of a density or calcifications. And we may recommend that the patient have a biopsy. So we are equipped to do the biopsies here. We do biopsies either under ultrasound or what we call stereotactic guidance.
You talked about mammography as being so important, and people and women should start having them age 40, earlier if they have a history of breast cancer. Some people say that once women get older, they should stop having them. Is that true?
I don't think so at all. And the recommendations about 10 months ago from a big screening study did suggest that patients stop having mammograms at the age of 70. We have patients who come in their 80s. So these are people who are really healthy, would rather know whether or not they have breast cancer. And we say as long as the patient has a good quality of life, that they continue to have their mammograms. It's really not, contrary to what most people think, it's really not a very painful proposition. The breast is held in compression for, 2 to 3 seconds. It's really not the end of the world. You won't have any bruising, and it's just so worthwhile. I spend a lot of time talking to my friends about this and making sure that they have their mammograms every year.
I actually remember back early on in my lifetime testifying before a legislative committee that mammograms be covered by insurance. This is a long time ago. Yeah. This is something like 20 years ago. Because it is such an important screening tool. You have a team approach to treating patients here. You want to talk a little bit about the team approach?
Well, our breast center is, Kathy Varney is a nurse practitioner who runs the breast center, and she coordinates things beautifully. We have a wonderful team of technologists who perform mammograms. We have technologists who perform ultrasound. We also have we work with surgeons who come into the breast center. The oncologists, who I think you've spoken to, will see patients in their offices. We have access to genetic counselors, to plastic surgeons. There's a whole people who help with a reconstruction if someone's had a mastectomy. So we have lots of services. If they're not actually performed here in the breast center, patients have easy access to them.
It's heartening to hear that, because you're all working together to make sure that the focus is on the patient and what the patient needs.
That was why years ago we decided to start the breast center. One of the things that bothered me and bothered a lot of people was that there was a delay. By the time I looked at a mammogram and said, I'm worried that this is a cancer, by the time that patient could be seen by a surgeon, would ultimately have their surgery, maybe need chemotherapy or radiation, that could take quite a bit of time. And what we found now that we have the breast center here, that time interval has significantly decreased. So we can say, I can grab a surgeon in the hallway and say, I just saw an abnormal mammogram. The patient's still here. Would you see the patient?
That's terrific. Doctor, thank you very much. I have learned an incredible amount, and I am certainly glad that the Sam and Jennie Bennett Breast Care Center is here in our community.
So are we. So are we. Thank you.
We'll be right back with another segment of this great show.